Hi, my name is Richard Landaverde, and today I'll be speaking about the video presented that concern the federal budget. The problems facing the federal budget are ones that cannot be solved without cooperation from Democrats, Republicans, and the people. The amount of spending that is related to healthcare reform is extensive. Oberlander stated that President Obama's plan would cost somewhere between $1 trillion and $2 trillion over 10 years. That would include $100 billion to $200 billion a year in new spending. To help counteract this spending, Oberlander states that Obama called for $316 billion in savings to help fund healthcare reform. But as presented in the video, there's no unanimous understanding that these measures will help fund the bill. Throughout this video, there's no attempt to address the people's responsibility, and I find that that's one of the key things that needs to be addressed, especially from a nurse's point, is that people need to take responsibility for their own health care. All the preventative care in the world can be offered to help contain costs. However, if the patient is not willing to consent to participate in the care, then there will be no savings in cost. In a study presented, the majority of healthcare providers agreed that a major barrier to treatment of lifestyle-related conditions is patients' unwillingness to change their habits. As a nurse, I understand that everyone should have the right to make their own decisions about their own health care. However, if every citizen is expected to pay their part to help fund this reform through taxes, then everyone that is entitled and is a willing participant in this reform should be willing, if not mandated, to participate in preventative care. And these can be non-invasive measures such as simply going to a class related to diabetes, smoking cessation classes. As a nurse, I've felt the impact of mandatory preventative measures. One hot topic is the implementation of mandating flu vaccines for healthcare workers. According to Eisenberg, the Children's Hospital of Philadelphia has implemented mandatory vaccines for all healthcare employees. If the employee declines to receive the vaccine, they are given 2 weeks unpaid leave. After that, if they still decline, they're asked to resign. The nurse is mandated to receive a form of preventative care instead of being required to wear a mask and follow proper hand hygiene for others' health and to help contain costs. Why can we not ask those receiving the benefits to take part in preventative care that will do the same? To help save costs, why can we not implement actions such as this? Everyone is allowed to enroll and take advantage in the expansion of entitlements. However, with the enrollment, you're also taking on certain responsibilities. Recipients are mandated to participate in preventative care, and if not, they're simply removed from the entitlements. Not saying you can't get care, it's just saying you're not going to be able to receive the subsidies that the federal government's going to offer. This would help reduce costs by limiting the amount of excess spending on those that will not participate in preventative care. That will surely help prevent costs in the future by helping ensure that they'll be healthier. Moving on, throughout this course I found topics that are very interesting. Three of the most interesting topics that I like to reflect on are cost of healthcare, cost containment, and access to healthcare. I find these the most important because as a future practitioner, I have to be aware of exactly how much it is going to cost when I provide interventions for patients and how I should limit the cost, how I can help contain costs for patients, because I want to provide care that's not only beneficial to my patients physically, but also will help them be able to save money. Also, the cost containment issue was very interesting. I never thought of cost containment as painful or painless. Through the readings, you understand that painless cost containment would be ways of containing costs that would help everyone in the end, not just a certain few. Also, the access to health care. The number of uninsured I never really knew was that high. I always thought, you either had private insurance or you were on Medicaid or Medicare. I didn't realize there were that many people out there that did not have insurance, and insurance clearly limits the amount of healthcare access those have, because they see how much it's going to cost them to go just follow up with their physician to see if they're okay to receive those preventative measures. These are things that I'm going to take with me as I go forth and hopefully become a successful practitioner. Thank you. That's all.